Good morning, everybody. This is Dr. Gabriele Jasper on Painless with Dr. Gabriele Jasper.
That's right.
MD, interventional pain physician. I'm here to talk to you about a little bit about what I do. And I'm sure, hopefully, there's people out there that know what I do already listening to me. We have anybody online here today? Anyway, I'm an interventional pain physician. What I do is I find a pain generator, get rid of the pain generator, and the patients usually do well.
Yeah.
I don't treat patients with pain medicine. I'm kind of famous for that. Some patients come in and they're on tons of pain medication. For example, yesterday somebody came in that's been on pain medication for spinal stenosis for 8 years. And this guy, I asked him, I said, what makes you feel good besides the pain medication? He says, sitting down. I said, sitting down, excuse me, you're sitting down right now. Do you have any pain? No. So why are you on pain medication?
Right.
You know, he goes, I like to do things. I said, well, you got to take so much pain medication to get rid of the pain from walking and standing that you will not be able to walk or stand.
Right.
So sit down, or come to me and get it fixed. And nobody's fixed this guy.
Yeah.
But we're going to fix him. We're going to fix him at the Jasper Spine Institute because that's what we do, especially with spinal stenosis. Young guy, probably younger than me. Anyway.
We got Connie here right away. She said, good morning. I appreciate the help you have given me.
Well, you're welcome. My pleasure.
Good for you, Connie.
So what we do is we treat a lot of stuff. We treat spinal stenosis, as I said. We treat sciatica pain. We treat arthritis of the spine, arthritis of joints, torn rotator cuffs.
Mm-hmm.
We treat also minimally invasive spine surgery, endoscopic surgery for herniated discs.
That changed my life.
Yeah. So there's tons of stuff that we treat, and as I always say, every 6 months or less or a little bit more, something comes out new.
Oh yeah.
Even the procedures that have been out are improved.
All these innovations that are coming out now, they're coming out quicker than they ever did, and the shape of pain medicine is changing. Like,
oh yeah, it's evolved. We started doing just epidurals, blind epidurals, and now we do it the sophisticated, intricate, minimally invasive spine surgery. Of course, there's still pain doctors out there that just do a series of 3 epidurals, and when that doesn't work, you go to a surgeon. That doesn't happen in our place.
Right.
But I like to introduce a guest here. He's been on this podcast before. I might have been on the radio, but he's on the podcast now. Yeah. Marco Battaglia, and he's going to introduce some regenerative medicine, and specifically it's PRGF as an abbreviation. And Marco's here, and he's going to explain to you what it actually is and how it can help. And by the way, did I sound like Joe Biden? Oh, by the way, number one.
No.
Anyway, let's not get into that.
Trust me.
Anyway, and by the way, I actually used it on myself 7 months ago.
Yeah, you did.
And I was not 100% pain-free, but I was able to do everything. I didn't complain about it. But hey, listen, I need a new shoulder, but it's not the time now to get a new shoulder. So right. I use this PRGF, and I was good for 7 months. Now it's starting to bother me, and I just gave myself a shot Tuesday, and it was sore for a couple of days. But it's a different type of pain. It's a pain that you can feel it. The stuff is working.
Yeah.
But that pain from the arthritis, a lot less, and it's going to get less and less and less. Hopefully, I'll be able to make it. So when I do have time to get a total shoulder replacement, I can do it. So, Marco, let us know what's going on. What does this PRGF mean?
And just so everybody knows, if you go to our website under regenerative medicine, you're going to find a full readout of what PRGF is and what it can do for you.
Right. So PRGF is an acronym, which stands for plasma-rich and growth factors. I know prior to us ever starting any business, you were familiar with the industry.
Here. Just move over to me.
Oh, we got a little technical
difficulty here.
Which probably should have been checked previously.
Yeah, I did a mic check. All right, there you go, bud. Oh, sorry. There you go.
Can you hear me from here?
Yeah.
All right. So, good. So, plasma-rich and growth factors is the most innovative form of a well-known procedure called PRP. I know that you have been familiar with platelet-rich plasma, as most orthopedic or pain management facilities I go to, it's what they are currently utilizing. Um, Understanding our system comes with understanding multiple different flaws that are in the modern PRP systems that we truly perfected with our protocol, drastically increasing the odds of success for this procedure. Some of these flaws consist of, a lack of studies, a lack of recovery of platelets, a lack of the utilization of the platelets, injecting pro-inflammatory cells, and the overall lack of preservation of the growth factors in the injected area of the patient. I think it's important to potentially touch base on all of those to really, uncover what we have to offer. But when it comes to these studies, if you were to take the top three performing PRP companies, which debatably would be MSite, Cellfill, Regen Labs, or Eclipse, all of the studies combined do not even equate to the scientific backing that we have established. We have over 300 publications with thousands of medical doctors happily putting their name behind our system, where altogether they maybe have 120 between multiple companies alone. So that definitely goes to stand for something in the scientific community. It's also important to know that not all PRP systems are the same. Just because you have read an article, some type of study that shows platelets can release growth factors, proteins, create a regenerative effect, that does not mean it's a one size fits all. There are different centrifuges that have different rotations per minute. You have different anticoagulant percentages, all different variables that equate to a different answer. Do you want me to just kind of keep firing
Go
away?
ahead.
Yeah.
I mean,
Okay. All right.
that sounds like a lot of information
It
that some
definitely
people
is.
don't understand.
Sure.
But real quick, what happens is, I think technically, with this PRP, PRGF, all this regenerative stuff is supposed to, as it says, regenerate your tissue. Of course, if it's very, very bad, as far as bad arthritis or complete tears, it's not going to work. But
Right.
it may improve the pain. It may regenerate some portion of it. It most likely will make it stronger. But the main thing is the pain. It calms down this pain. How does it work as far as let's say compared to a cortisone injection?
Sure. So for something like the cortisone shot, I mean, this is a typically anti-inflammatory. That is the main goal, to relieve the inflammation with a cortisone shot. Not only are you potentially looking at long-term side effects, whether it's liver failure, there's definitely studies that show there are negative complications. So when you compare it on that aspect, there's virtually zero adverse reactions when it comes down to a treatment like PRGF, which anyone that kind of values a rather homeopathic, natural style of healing, you definitely have an edge there. But how these growth factors work, they are pretty much, once injected, sending signals to surrounding cells to enter their cell cycle and proliferate. The process is called a receptor tyrosine kinases, and this is pretty much just broken further down to where, once attached to the cell membrane, the signals being transmitted go directly to the nucleus, and you're able to see your DNA stimulated, gene replication, proliferation. There's a number of different effects that occur.
So basically, what it's doing in layman terms, the growth factors and all the good stuff, in layman terms, all the good stuff you get from it actually goes into the cell to regenerate, to make itself better or
Correct.
regenerate the cell.
Exactly.
It turns the key on. In other words, you have the center of the cell, which is the nucleus, which contains all your DNA and genes and controls what the cell's going to do, whether it's a muscle cell, cells that produce
Cartilage.
cartilage,
Yeah.
cartilage,
You got it.
any kind of cell in that area, the membranes, connective tissue. These things are stimulated. The cells are stimulated to produce that. How does it actually happen? How did they prove that this actually happens?
Right. So we have a number of different studies that would, I guess, show just before and after of maybe someone who had damage to their meniscus. You inject our gel into that area, and under another MRI, you're able to see that reparation occur. So they have a number of different studies throughout your body, even in the field of dermatology, where they'll look at the face, they'll look at your skin, the amount of collagen that's reproduced alone. So we know that the growth factors definitely are the mechanism of action. But as far as anything,
So they proved it works.
yes, it absolutely.
This is no
is.
joke. It's not
It's
hocus
not
pocus.
No, it's not.
This is the actual thing. And listen, I could talk from a layman term, as a layman's viewpoint to a certain extent. I'm a physician. I know the mechanism of action, but hey, I did it on myself and it works. And I've given myself steroid injections, cortisone type injections. But go back a little. I'll go back a little bit on that to explain what you meant. Sometimes it's hard for people to understand.
Sure.
But what I usually tell my patients is cortisone, steroids, whether it be dexamethasone, triamcinolone, Kenalog, or cortisone itself, which we don't use anymore, it's a catabolic steroid. It breaks down protein, right? It's an anti-inflammatory, which means it's going to decrease the inflammation, which means it's going to decrease the swelling, the redness, and also the pain. That's inflammation. And that's the good side effect of cortisone type injections. Right. But the bad side effect, if somebody has a bad hip and you constantly inject cortisone or steroids in there, it's going to potentially break down that hip, and you get what they call avascular necrosis, where your whole hip could collapse. And it goes from being an elective hip replacement to an emergent situation where you got to the whole joint collapse. You go to the emergency room and they bring you to the operating room within a day or so, and they got to change the hip. And a lot of times it's very difficult because it's crushed.
Yeah.
It becomes a mess for the surgeon to go in instead of just doing it with somebody that just has some, moderate to severe arthritis without avascular necrosis. Whereas that will not happen with regenerative medicine with PRGF, because it is an anabolic type mechanism. It builds protein. It builds all kinds of tissue that's injured, based on the fact that they're stimulating the cells to produce what you need at that location.
Absolutely. And then how we also will drastically increase the odds when it comes down to, what is going on here?
I don't know, bro.
Technical difficulties.
Yeah, there you go.
Oh, it's this one.
Yeah, just turn it towards you again. Keep talking.
There we go. I got you.
So how we drastically increase the odds, and why many providers are actually kind of debating if this is a hocus pocus procedure, is because of the negative impacts that modern PRP systems have kind of established nationwide in the industry, even worldwide. If you could understand this concept that once you acquire this amount of plasma from the patient, understanding that it's 90% water, it doesn't mean that there is an abundant amount of platelets inside. The platelets are the vehicle that we need to get into in order for any regenerative effects to occur. But it's not the platelet itself that actually is the sole reason why this takes place. It's what's inside the platelet. That's the growth factors, the proteins. If they don't actually release from the platelet, it's useless.
So you're going to tell us how your product is better than straight platelet-rich plasma.
Absolutely.
Because there's, like you said before, platelet-rich plasma is just plasma that has a lot of platelets in it.
Sure.
And platelets have the good stuff inside the platelets.
Exactly.
Now, how does yours differ in layman terms?
Sure. So in layman terms, what we we're able to prove, we have studies that back this up 100% that will show that your body actually isn't able to process a very high concentration of platelets. So if you have, we have 2.8 to 3.2 times the base concentration of platelets, which is a significant amount. And not only that,
compared to PRP.
compared to, well, so some PRP systems may have slightly more, majority are in that 1.2 range. But what we noticed is that even if they had more, they're not using all of them. If your body is only able to process roughly 40% of those platelets, and the other 60% are either remaining stagnant in the fibrin matrix that's
They
created
get
once,
metabolized, basically.
yeah, or back into your bloodstream, exactly. So what we did was we created a way to add a precise amount of the activator, that calcium chloride that you'll see your staff inject to the plasma, that will actually put the platelets under this immense pressure in the syringe, pre-releasing all of the regenerative effects. Some of our pain management doctors, they refer to this as just growth factor injections, as we don't actually
So
inject.
how's the mechanism? In other words, you put this enzyme in, right?
Yes.
And what does it actually do to the platelets?
It simply just is pre-releasing all of the
It,
growth
does it
factors.
dissolve the membrane, the
No.
outside?
No,
I-
all of the proteins, all the growth factors. We have different studies where you'll see the IGF, which is the insulin growth factor, the PDGF, platelet-derived growth factor, VEG, vascular endothelial growth. There's 4 or 5 different main growth factors that we have shown studies that will strictly, that is what is getting injected into the patient. So instead of injecting platelets into the patient and hoping that there is an activation that it actually replicates what our body does naturally, we are guaranteeing that 100% of those platelets are going to be utilized in this procedure as a whole.
because everything that's in the platelets coming out, and that's what
Exactly.
you utilize.
Yes.
How does it? I still don't understand. How does it actually come out? Like, what forces it to come out?
Well, so from my understanding and how this was explained to me is just that whatever chemical reaction is occurring in that syringe, it is pretty much condensing the platelets to that shell that encompasses everything inside is broken to where that is what is pre-released in the
All right,
syringe.
so it just comes out of the platelets. All right, makes sense.
That's it.
Good, good.
Yeah.
So I mean, it works. It works, and we have it. You know, some people come in demanding certain products in my office, and I try to explain to them how other products might be better. But if people come into my office, they got it set in their mind, they want something, then you kind of give it to them,
Yeah, yeah.
because you're not going to force something that they don't want. But or I'll tell them to do some research and come back and do it. But they want it that moment, and they're paying for it. This is something that the insurance companies don't pay for, and you got to understand that. Don't get upset about it. Well, I mean, I get upset about it
Yeah.
that I have to charge patients, but it's it's a home run for the patient. Not quite a home run for the doctors, but if the doctors like me who gets very satisfied when the patients do well, then it's a home run.
Yeah.
Financially, it's not a home run because we, as far as physicians go, with the overhead and everything, we don't really make any money. It's almost a courtesy for our patients. You go to some places in down in Florida or California or these places where rich people live. It's going to be stupid expensive. They're going to charge unbelievable money. Hey, Ocean County, people will not, but they won't even pay for the little bit of money that we charge.
Yeah, yeah.
People will say, just give me a cortisone injection. That's what we're up against. And that's why we're here. That's why we're here talking about it. That's why Marco is here explaining it to you, because it works. It works. And until the insurance companies pay for it, you got to pay for it. And it's not killer money.
Yeah. So from the simplest explanation, with the what do you call it? The PRG, the F, the GF, right? Is like a starting pistol. So the platelets know what to activate, and instead of waiting around until they do.
Correct.
Yeah.
Instead of the body having to break it down.
Right. So this is like they get injected into the place they need to be, and poof, they get to work right away. Right away.
Yeah.
Yeah. I mean, that as a patient, that's all I need to know.
Right.
Yeah.
No, well, that's where they get the name plasma rich in growth factors,
Yeah.
because they are not injecting platelets. We are injecting growth factors and proteins, and we are having them, like you said, get to work from the moment they are injected to the patient. And what the calcium chloride also does, it will, can they hear me? And what the calcium chloride also does is it forms this micro clot.
You put the picture on him.
Yeah, sorry.
It forms this micro clot that, this is where we have that 15-minute window to inject the patient, because this is what's happening in the syringe. That clot actually is what preserves the growth factors in that injected area, making a controlled release in that area, really targeting the patient's needs and keeping these growth factors present for a prolonged period of 21 days. And why that's significant is because there are some PRP companies where the growth factors are only preserved for 72 hours. So that's a 7-time increase as compared to what the average PRP company is doing. And that's
What's the average? How long does it take usually with the average PRP?
Like less than 72 hours. And that is, being generous, as most are in that 12-hour mark. This is also because they inject these pro-inflammatory cells, the leukocytes. We don't inject anything white cell related to the patient.
How do you get that out?
So with the spin of the centrifuge, how this technology was designed, we keep them in the buffy coat of the patient's plasma. So that 0.3 to 0.5 ml area is where any white cells, if there's any left, will be in that area. And that's where we do not draw any plasma from this area. Other companies, they either have leukocytes all throughout the plasma based on their spin, or they have to extract the plasma from the buffy coat, as that's where their platelets are highest in concentration. Unlike our system, it is sporadically spread out all throughout the plasma where these platelets are actually suspended.
So basically, the idea is to get a high concentration of platelets, a low concentration of everything else that is not platelet related. And with this specifically, it makes all the best part that you find inside the platelets come out.
Yes.
So you can't have a lot of red blood cells, can't have a lot of white blood cells, because leukocytes are white blood cells. To make it to understand, all of these things got to be out of it. It's probably not 100% gone, and no matter what you do, but there's a technique that you use based on how fast your centrifuge spins, and by it's the weight of the white blood cells compared to the platelets, and then they find themselves concentrated in a certain area, the white cells, and you don't take that part of it out.
That's it.
And that's it. And that's a technique that we use in the office to make sure.
And
I wanted to say,
Panning for gold, right?
yeah.
so I mean that's pretty much in a nutshell. Is there anything else specific? But because I think, Jeremy, don't you have a testimonial that actually had this done?
Yeah. Let me get it up and ready.
I guess so. I mean, the only last, thing to address would be pertaining to these leukocytes. Why it's a variable we value removing from the equation is because of an enzyme that they create called proteases, which we see will actually feed on the growth factors. So you're injecting your patient with platelets. You're hoping this regenerative effect occurs and the growth factors come out. At the same time, PRP companies have these enzymes feeding on the regenerative effects. This is why they have less than 72 hours of the growth factors being present, and why we're able to keep such a prolonged period of studies showing past 21 days. So
21 days. I mean, so it's still working. It works longer. If you got somebody's going to work in your backyard to clean it up, and they do it in 1 hour compared to doing it in 5 hours, it's going to get a better job after 5 hours.
Absolutely.
All right. So we have a testimonial here. Let me cue it up here. Okay, I'm gonna show it to the camera, and I'm gonna hold it up to the mic so you guys can see it. A little low tech here, but
a little low tech here. I thought we were a highly sophisticated podcast here.
Right. Well, here we go.
Let's switch the
All right, we
camera.
have Pete here. He got PRGF in both of his shoulders. How you feeling?
Feeling a lot better. A lot better.
About what percentage would you say?
I'd say in 3 weeks I feel 50% better.
50%? That's great. So tell us a little bit about what it was like before getting PRGF.
Couldn't sleep. Couldn't roll on one side or the other. Felt like a constant toothache in both shoulders.
What's your
And
elbow right there?
during the day, if I went to open or shut a car door, I could feel it. It was just discomfort, constant discomfort. And now, I mean, like today I feel great. I don't feel 100% yet, but I feel like I can do anything if I want to try it. I sleep well. I'm on the right track.
So you're thinking about going back to the gym, maybe doing a little more weightlifting and, regenerative medicine.
Yeah, I feel I'll probably start doing a little light exercise now. I haven't been doing much other than cardio. And I'll start to maybe bring it back in a little bit at a time and see how it feels.
All right. Thanks, Pete.
Thank you very much.
Man, that's what I call a non-professional, down-to-earth interview. We got the nurses screaming in the background, "Hey, when are we having for lunch?"
I saw you walk past in the hallway.
I walked past.
Yeah.
Well, I think we should get a little bit more organized when we do something like that. For example,
Yeah.
maybe close the door at least.
Phil, I didn't do
It
that
seems
one.
like a
That's not
genuine-
mine.
It screams a genuine, honest feedback.
Yeah, I
which,
mean, it's
one treatment for that guy to have 50%, couldn't sleep,
in
couldn't open a
3
car
weeks.
door.
Yeah,
That's a solid result. That's a patient that I would recommend within 90 days hitting the area again.
we should have a follow-up on that guy. How long ago was that?
That had to be in the past like 45 days, give or take.
Yeah, so we should give the
Definitely
guy a call.
coming up.
Next time we do a podcast, we do a follow-up.
For sure.
I mean, he might be 80 to 100% pain free at this point.
Yeah.
But today was I said we got to figure out a way to doing this a little bit better as far as testimonials. I mean, is that the kind of testimonials we're going to do? Because today was going to be a testimonial day. Of course, I let you know yesterday.
Yeah. That was the thing. It was, and then finding out Marco was coming. I just
an hour ago.
Yeah.
Did not know till last
So,
week, yesterday.
That's all right. But I mean, do we have any testimonials of certain types of procedures that we did?
I got a testimonial. We don't have to show the we don't have to show the video. I'm just going to hold it up like this, and it'll be better for everybody to listen to. If you guys want to see the video, please visit our Facebook page. That's Jasper Spine Institute. Do a search on Facebook. You'll find us. Go there. Like the page too, because then whenever Doc and I go live, you're going to get a notification. So this is a great guy. He had a.
I think you should maybe set it up somehow with the camera.
All right.
To make it so it doesn't go all over the place and let the people see it.
Okay. All right. It's going to be me and this camera right here. Now, this guy he loves to talk, this guy. You know who I'm talking about. And he's so overwhelmed by what you did. But here we go.
Harry, so tell us your story here, Harry.
What procedure was this?
I have been in pain.
What procedure was it?
Nonstop, 24 hours a
Oh,
day.
it's for the space of the Minuteman?
Yeah.
I have been to 3 or 4 neurospine surgeons who all indicated that I have all my lumbar vertebrae are compromised and that I need to have them all stabilized with screws and rods. To me,
What'd you think about that?
it's archaic.
Yeah.
They were doing this 50 years ago, and they're still doing it. Nobody has even tried to they use stainless steel. Why don't they use carbon fiber? It's, it's stronger. But they don't even try anything. They just keep the same stuff all the time. And the doctors I went to were very well respected and very well known, and they all wanted to do the same thing. I refuse to have that done. I'll live with the pain. The pain I know I know. The pain I don't know, I don't want to deal with.
Yeah.
So I finally came to Dr. Jasper. I was told I needed a neurospine surgeon. I don't believe he's a neurospine surgeon, but I came to see him because I saw a commercial by a gentleman who convinced me that this doctor was the doctor to come and see.
That was me.
Well, I came and saw him. I told him my story. I brought him my MRIs. He looked at everything. He spent over an hour with my wife and I. He showed me every vertebrae and all my lumbar vertebrae from 14 different views and what he's going to do and how it's going to take the pressure off the nerve. And I said, okay, let's do it. But the first thing he said was, before we do it, I want to give you another epidural because I want to see if I can get you out of some temporary pain. He gave me the shot. It really didn't work. At the same time that I was seeing Dr. Jasper, I was finishing up with my other pain doctor, who I was seeing for medication maintenance for opioids, which I had been taking for 20 years for cancer surgery.
Right.
I spoke to her and said, I had pain in my back, and she said, that's probably your hip. We'll set you up to get a shot in your hip. Well, a week later, I went for the shot in my hip, and the doctor asked me where it hurt. I showed him, and he said, son, that's not your hip. That's your sacroiliac joint. He gave me a shot there, and I got about 3 weeks relief. Not completely, but I got a great deal of relief. I came back to tell Dr. Jasper, and that's when he said, let's take a look at your hip, because I had x-rays for that. And he said, your hip is shot, and the pain that you're feeling in the sacroiliac joint could be easily caused by your hip. They're vice versa. You never know which one's causing the pain, where it's radiating from. So we got to deal with your hip first. So I got a shot for my hip. He asked me to wait 20 minutes. It came out 20 minutes, and I was dancing.
What?
I'm a happy camper, and I want to tell you people to listen up and pay attention. If you have back pain, I don't care from what. I worked very hard. I was a landscaper. I owned a
Pounding
nursery.
his fist.
You could twist your back. You could do, I don't care, whatever you do. If you have back pain, don't go and see an orthopedist. Don't go and see some other doctor. Go and see Dr. Jasper. Let him diagnose you and listen to what he's telling you, because this man knows what he's talking about. He's not afraid to bend things and try new things to help you with your pain, and you're not going to find that anyplace else. I've been around. I'm 73 years old. I've seen more doctors than I care to even think about. I've seen enough doctors for the rest of my lifetime, okay? This man will help you. Pay attention. Listen to what I'm saying. The man will help you. And not only will he help you, he's compassionate as hell. I can't say anything more. I could go on for hours just telling you, but just please listen to me. I'm begging you, if you have back pain, go see Dr. Jasper.
That's great, man. That's great. You take care of yourself, and I hope you keep feeling good.
Thank you.
All right. I didn't do that one. That's not mine.
What was it?
Yeah, that was our recording right now.
Oh,
But that was with a spacer from Dr. Jasper, and you guys saw that patient. He couldn't stop pounding his fists on the chair because he was so emphatic that Dr. Jasper is the only doctor for him and his pain.
he's still got to get his hip done, that guy.
Yeah.
he's stubborn. You don't want to get his hip done.
Yeah.
But good guy. He was in this week, of course, with a hip pain.
Yeah.
All right, so that's a good testimonial. We did that, and basically what it is he had spinal stenosis. He had spinal stenosis at 2 different levels. In fact, he still feels pretty good with the one that we gave him, but he's feeling the effects of the second level, which we have not treated yet.
Right.
And we're in a process of probably putting in most surely we're going to put in a second spacer at that level. It'll give him more improvement. He'll be able to walk further, stand up straighter, his legs will get stronger, and that's the main symptoms of spinal stenosis.
Right. Now, relatively recently, we've had another great innovations with a product called Viadisc. And I have a lovely lady who you did it for, and she's just overjoyed.
Well, let me tell you a little bit about what Viadisc is.
Yeah.
Via disc, and we talked about it in another podcast, is you have the center of the disc, which is that red part where you
Yeah.
see that some of it's leaking out, causing you to have a herniated disc. But that red part in the center of the disc right here, this is called the nucleus pulposa. This is the nucleus of the disc.
Yeah.
And everything that happens to a person is because the nucleus and the disc are degenerative. It's called degenerative disc disease. And you lost the shock absorbing effect and you lost the height of the disc. And because of that, it creates spinal stenosis. It creates weakness in the wall of the disc, the annulus of the disc, and things leak out, causing pressure on the nerves. And by the way, I take that out endoscopically if that happens.
Mm.
Also, it causes bad arthritis and central canal stenosis and anything else derived discogenic pain, which eventually could cause vertebrogenic pain, which is pain in the bone.
Mm-hmm.
If we never had degenerative disc disease, we'd never have a problem with our spine.
Right.
That's the root of all evil, and that's what I talk about. Now, within the last 10 years or so, they've been developing a method to put in new allograft nucleus that they get it from cadavers, from people who donate their body to science, and they anywhere from 15 to 55, they retrieve perfect discs from these people.
Mm.
Right. And when they retrieve the perfect disc, they get the central part, the red part, and they harvest it and they bring it down to a powdered form. And then we reinstill some normal saline and we inject it into the center of the disc. And they've tested it. They've tested it to the point where it's almost impossible to tell a difference.
Yeah, that's
As
amazing.
far as elasticity, strength, tensile strength, shock absorber effect, the consistency, all of this is the same. It's hard to tell. They measured it scientifically with measuring devices, but now we've been injecting. I was skeptical in the beginning, saying I don't know if this is going to work. But guess what? I've done probably pushing 100 at least, and these patients have been anywhere. The worst one, 40% better. 40% better. That's one pain generator.
Yeah.
Up to 100%. Now you managed to get a testimonial. Somebody had that done.
Yeah. And you guys, I want you to pay close attention to.
Should melt that.
I want you to pay close attention to how
Take
well
the microphone,
yeah,
the headset, and put your phone in it and point your camera down so it doesn't go over.
Pay close attention
yeah, here.
how
Take the microphone.
Wait, now I'm on our thing. It keeps flopping back and forth.
I don't know how I was talking without talking there.
Yeah. Come on, load up.
Yeah, I mean, it's really amazing stuff.
Yeah.
The way it works, and it's just part of what we do, and it's a new tool in the tool shed.
And
That works.
the fact that I can bend it. Hi, my name's Janice, and I'm at the. Hi, my name's Janice, and I'm at the Jasper Spine Institute, and I've been coming here for at least 3 or 4 years. I don't know how my initial pain began. It was bending over. It was twisting. I can't even do my floors. I had to get a cleaning lady. And I came to Jasper, and it was amazing. I had no pain for a year and a half. And then later on, the pain revisited me, and it seemed to have been worse. And I went to Dr. Jasper, and he told me about this new procedure called Via Disc. And it was a procedure where, in essence, the nucleus of your spine is rehydrated with that of a cadaver. And it takes time, but it actually rehydrates the discs between the spine. And I said, I'll try anything. I was that desperate. The pain hurt that badly. And it was coming along fine. There were 4 visits for that. And the last time I came, there was still some residual pain. I had pain in my coccyx. And he said, well, we have a cure for that.
I could fix that.
This man is amazing. I put all my trust in him. And the day he gave me the coccyx injection, the pain was gone that day. And
I got my
I
own
had
recipe
no
for that.
pain on any part of my body that I had been visiting for.
Cocktail.
It's gone.
Oh man, that's amazing,
Yes,
right?
he is amazing. I find him extremely knowledgeable, willing to try new procedures, which he did with me.
Right.
And I've been extremely pleased. I can't recommend him enough.
Right. Now, it just seems to me like this was keeping you from doing a lot of things and, taking part in things and stuff. Like, what was it keeping you from?
It kept me from really enjoying the walks on the boardwalk with my sisters, even regular household things. I'd have to wait for my housekeeper to come in and do things for me that I normally did.
Right.
And it's just given me a new lease on life again.
Yeah.
And the fact that I can bend and stretch and do the things I couldn't do before is absolutely amazing.
That's brilliant. That's brilliant. Thank you so much.
Very good help.
I'm glad you're doing good. Take care.
Thank you.
That's another amazing testimonial. It's the first one we have and we have tons of them that we can ask, and they're always willing to do a testimonial.
Yeah, and that's 3 testimonials on 3 different procedures, and the people are loving what you're offering now. And
It makes my job fun.
oh yeah,
I mean, it's tough. We see a lot of patients. I'm getting busier and busier. However, it's so rewarding to have patients come in every day.
Oh yeah,
for something like that.
Mm-hmm.
I mean, and she couldn't bend. This is the kind of pain it's almost complete. It's on the other end of the spectrum when it comes to spinal stenosis.
Yeah,
it's called discogenic pain. It's pain that is derived from the disc. And it hurts more when a patient sits down. It also hurts standing up, but especially when they bend over. When they bend over, it hurts. It hurts more when they sit down for any period of time. They can't lift anything, right? And most of the time, the pain just aches.
yeah.
But
that shows
it
you.
all went away with her.
Yeah, that shows you just like with all of the different pain generators and the pain where it generates, people can just realize that very clearly that those things when they occur, they're everywhere. It could hurt you in so many different ways.
Because and she talked about she had to come like 4 times. Was it 4 visits, and it was done.
Yeah. That
4 or 5
coccyx,
visits.
that coccyx
Well, you know why?
was
Because
great.
we're talking about the Viadis. We'll go to the
Okay.
coccyx, but
Yeah.
but the Viadis, you could only do 1 level at a time because the company had to get FDA approval. They have to process it. The facility is thousands and thousands of square feet. A lot of people there cleaning with the sterility. It's expensive, and the insurance company only pay for 1 level at a time. So, and rightfully so, because I'll have patients that have 5 bad levels. I'll do 2, and then they're good.
Right.
So, but if they're not good after 2 or 3 or 4, we continue until we do all the discs, and and it's successful. And it does not take long to do this procedure, and most people do it awake. It's a needle. It's a needle derived procedure where you just put the needle, you aim it under extreme accuracy using a fluoroscopy, live fluoro, and you stick it right in the center, and you can look at it from the anterior, posterior view to the side view, lateral view, anterior and lateral view, and it pinpoints right in the center of this, and then you put it in, and you're done. There's no time at all. Some people need anesthesia because they get nervous, but that coccyx, I've developed like a cocktail and technique over the years, and now it works. It's been working for probably 10 years. That very rarely it will not work. I mean, if your person has, a fracture, a fresh fracture of the coccyx bone, you got to wait for that to heal.
Yeah.
It's like breaking a bone. You break a bone, you inject it. It's not going to do anything. The bone's got to heal.
Right.
But that's it. And that's a great testimonial.
Yeah. So most of this can be found on all of it can be found on the website jaspermd.com. I'm going to pop that up right now. And Marco, we're going to come back to you. All right. Do you want to wind up?
Yeah, I mean, overall, just to kind of touch base again on why you have me here today is, our procedure, plasma rich in growth factors, is offered at Jasper Spine. I think anybody who is looking for a natural form of healing, I think this is certainly the treatment for you. It really is designed to kind of get to that root cause and repair yourself from within, as compared to just slapping a Band-Aid like some of the other procedures that are out there. If you're dealing with knee pain, shoulder pain, whether it's a cortisone shot or the hyaluronic acid injections, there are a number of different reasons why this would be overall a superior treatment for you or anyone's patient base in general.
Right.
So,
Yeah. All right. So we got, look, our Barbara used to work in the office with us all the time, and then she moved. She missed me again, she said, when she came to visit.
Yeah, she was here not too long ago.
Yeah.
She came to see the babies, the office.
Oh, yeah. Let's talk about that for just a second, okay? Dr. Jasper is a no-no. Once again, he's got the most beautiful granddaughter you've ever seen. Gabriella can make beautiful babies. I will say
I
that.
gotta give her husband some credit too.
Oh yeah. Tyler. Yeah, the man did great.
Yeah.
They both did. And it's a beautiful little girl named Juliana. What was her middle name again? Juliana. Oh, she just told
Don't
me.
ask me hard questions like that.
But yeah. Congratulations. I want to say
Thank
that.
you very much.
Yeah.
Yeah, we getting back to the practice. Something happened yesterday that just as a change of pace. And I like to talk about this stuff. And it's a good point. And I learned a lot with this one particular new patient that we had yesterday. I had a pretty arrogant patient come in yesterday who I don't know if arrogant was the right word, but it's hard to actually describe what kind of patient this was, but he troubled me. He troubled me. I had to throw the guy out.
Belligerent.
no way.
Kind of belligerent. Belligerent might be the word.
Yeah.
I mean, see, the point of this discussion right now is to tell people out there that if you come to my office, I don't want to hear you say, "Doc." I mean, I like to hear it, but the reality is, you need to understand your pathology. You need to understand what's wrong with you, in layman terms, and you got to. The only way to understand how I'm going to fix you and make you better is understanding what you have.
Right.
And some people, and there's not all of them, but a good percentage of them say, "Doc, listen, just fix me. I don't care about what I got or anything. I trust you. You do everything." That's music to my ears. However, it's not good.
Yeah.
And on those patients, I tell them, I say, "Listen, I need to explain to you. I'm going to show you. By the time you're done, this 20 half hour, 45 minutes I'm spending with you to understand what you have wrong with you and how I'm going to fix it, I want to do it till you understand, because you got to sign a consent saying that Dr. Jasper and his staff has explained everything to you, and I understand everything perfectly. Therefore, I understand the risks and benefits of this procedure and the prognosis and the outcomes." With a clear head, as grown individuals who are the master of themselves, not idiots, but with a brain in their head, and a head on their shoulders, should understand that this is the way things have to be. Now, this guy came in, and I was trying to explain to him what's going on, and he wasn't paying attention. He was rolling his eyes. He was telling me, "I don't care about this. I don't care about that. All I know is I had epidurals and it's 4-5 and I got spinal stenosis and I want you to fix me."
Yeah.
Right? Which I can understand. I said, "Well, do you know what spinal stenosis is?" I asked him. He goes, "Yes, I know what spinal stenosis is." Very sarcastic. I was like, "Okay." I was starting to try my patience, but that's okay. I was very calm. I said, "Well, fine." I said, "You explain to me what spinal stenosis is, and then we're done here. Then I'll just tell you what I can do if you truly know what it is." Now, maybe he took that as a confrontation, but I took it as, you say you know spinal stenosis. Just by saying it, and you don't know, it's not going to stop me from understanding that you understand.
Right.
Right. And he didn't know what it was.
Yeah.
He had no clue.
It's
whatever
like,
he said, I said, you're on the right track. I was trying to make him feel better.
right.
I said, however, here is the MRI. Here. He goes, I don't know how to read that MRI. I said, well, I'm going to teach you. By the time I'm done teaching you, I really don't want to learn how to read the MRI.
Oh, good grief.
That kind of stuff.
Yeah.
But I tried to do the best I could, and he wasn't paying attention. And then
You have to educate your patients on what's going to happen.
he kept coming at, rolling his eyes. He was getting pissed off.
Yeah.
I should at that moment say, listen, if with all due respect, if you can't comply with the way I treat patients, if you don't want to understand what's wrong with you, or if you don't want to understand how I can help you in my explanation, and you don't care, I'm going to have to discharge you officially as my patient, because it's I don't want to take any chances with you. But no, I kept trying, because I knew this guy only had one level to educate the people. I only had one level of stenosis. The patients that have one level of stenosis could be debilitated. It's a debilitating disease. And one level, these patients do the best.
Right.
Because you can pop that level open and they're like they were 20 years ago.
Yeah.
And I know I could do this because I don't want to deny this guy. Listen, people are in pain. Sometimes they're assholes in pain.
Sometimes they get in the way of themselves, like this guy
that.
was.
I understand that.
Yeah.
And I put up with that as a pain physician.
Sure.
But this guy, I can't even remember some of the stuff that he said. I even told Rosalind, and she was like, "Are you kidding me?"
Like chop chop.
Yeah, and then finally, the straw that broke the camel's back was when I was trying to explain to him about the leather belt. When
Oh yeah,
with
yeah.
the leather belt, because I got a great
For
way
the
of
ligament
explaining
flavum.
with spinal stenosis about the leather belt. About the ligament, the leather belt. When this opens up, it flattens out a leather belt like the ligament, and then this folds a loop like a leather belt. You take a leather belt, you snap it, you fold and snap it, makes a noise, it's flat. You push it together, forms a loop. That's what happens to the ligament. You stand up, it forms that loop and it rubs, common sense. And that's the easiest way to understand. You don't need to know the anatomy with that. But then I said to him, this is where I lost it. I said to him, did you ever see somebody fold a leather belt, or maybe yourself take a leather belt and fold it and snap it? It makes that noise. He goes, no.
What?
When was I going to see that? I was like, oh, all right. Well, I don't think anybody's never even heard of that. I said, what about the concept of folding a leather belt and snapping it where it's flat? He goes, I don't even know what you're talking about. I said, are you kidding me? Are you kidding me?
Dude.
Are you serious? He goes, and he's rolling his eyes. And while I was explaining it to him, he wasn't even looking. He was looking down on his phone. On his phone. I was like, are you listening to me? And I got up and I said, listen. I said, I went to shake his hand to tell him this physician-patient relationship is over. I can't treat you.
Yeah.
It becomes dangerous for you, for me, and everybody else in here. You have to leave. Of course, I probably shouldn't have said, don't let the door hit you on the ass on the way out. I was upset.
Yeah. See,
it's like, I try to help these people. And I told him, I said, listen, you see those 10 people sitting there and the 20 people I've seen already today, they love me. I get rid of their pain. I can get rid of your pain.
If you
I can
let
get rid of your pain, but you're losing out now.
Yeah.
I don't need patients like you in my office. I want patients that will listen to me, will understand, and actually be nice people.
Yeah.
I'm beyond that in my career.
Right.
I don't need the headache.
You don't need obstacles with
like
every
that.
patient.
I hate to act like that. But you know what? I see. Yesterday we saw 40 patients, and that was the first patient that I had like that probably in 2 years.
Yeah.
So you know what? The odds are in my favor. Most of my patients are great.
Right.
But once in a while you get a person like that. Why would I want to keep him in my practice?
Yeah.
Why? The nurses don't want to see him. I don't want to see him. They don't want to see me. Right? So why would we have him in the practice? And deep down inside, I felt bad for the guy.
Sure you did. Yeah.
Because as he's walking out the office, I could have helped him.
And he wouldn't let you.
And I even said in front of the nurses who who saw all of this that happened.
Yeah.
I said, should I have the office manager call him and give him another chance? You know what they said?
What?
No,
No.
he had his chance.
Yeah.
So you come to the spine, if you come to the Jasper Spine Institute and you're an asshole, guess where you're going? I hate to say it.
Yeah.
I hate to say it. I mean, you call it unethical.
Well, so, I mean,
I'm way beyond that point in my life, in my career.
sure,
That
sure.
I have to accept assholes. I can accept who I want, who I don't want.
Yeah.
You know, you just got to establish the relationship and unestablish the relationship. And if you're treating a patient, I think legally, if you're treating a patient, you can't abandon the patient. You can't get the hell out of here. You're done with me.
Right.
No, you got to give them a list of doctors that they referring physicians. You can't abandon them,
Right.
especially if they're on narcotics. But narcotics is not my thing, so that we don't have to worry about.
Right. Well, I mean, some patients who have suffered pain for a long time, and I was one of them. Your temper, your mindset is everywhere. I mean, like, you get annoyed, you get frustrated, you get jumpy. Then, now that's the time to find a counselor that'll help you. There's so many counselors out there that will counsel you about your pain, right, and prepare you to go to a doctor where you're not going to be so belligerent and angry and all of that, and you're more open to the possibility of getting better. So when you do come to the Jasper Spine Institute, maybe if you're an angry person, go see some help and then come to us, and you will be fixed. It happened to me.
When I was trained at UMDMJ with Dr. Wu, it was called a multidisciplinary center, pain center. And every patient, I didn't necessarily agree with this, but it was their protocol. Every patient had to go through psych evaluation before and after they saw the physician,
Right.
the pain physician. Because no matter who you are, you're in severe pain, especially chronic pain, there's a psych component involved. And we talked about the affects and positive, negative affect many, many times. That's not the topic today, but it's so hard to find a therapist that knows anything about how to treat patients with chronic pain.
Oh, really?
And they have their own practice. And you have a patient that I said, listen, you got to go see a therapist. That's like, forget about it. No, it's like saying you got to eat this nice big piece of fried liver.
Yeah.
How many people are going to get to eat liver?
Right.
You might have one that might want to eat it. You know what I mean? It's just hard to find the patients that would want to go to a therapist. But if I had the protocol in my office where everybody sits with a therapist for 10, 15 minutes. I used to have a therapist in my office. In fact, my brother's son, Luca, is a nurse practitioner, a psych nurse practitioner. And I'm trying to talk him into maybe getting a little bit of practice or some kind of do some studies on treating chronic pain patients, and then maybe coming down once a week.
That would be fantastic.
He would be there 8-10 hours a day,
right,
by me seeing some of my patients. I would gladly go see somebody right after they see me,
right,
or before they see me.
A lot of the times, even the girls at the front desk are going to get an indicator and might just pass that on to you. He needs a little help there first before he gets to you. Yeah.
All right. So, but you know, and I also, I felt bad. I even asked the nurse, do you think I overreact? She goes, no, Dr. Jasper, not at all.
Yeah.
You know, and this.
But you double check yourself, and that's good. You know,
I mean, I understand. Listen, most people that are in a lot of stress, there are some, like I said, there are some assholes that come in based on the fact that they got pain.
Right.
Listen, when somebody's under stress, they got pain. And everybody gets affected differently with pain. But if they are assholes, as soon as I start to explain to them how I can fix them, their face lights up. They're like, are you kidding me? I mean, somebody, you could help me? Yeah, I can help you. And this is how I'm going to help you. And if they know what the pathology is and how I can help them, it correlates. It makes sense. And so many patients say to me, Doc, my pain feels better today because of the fact that now I have hope that you're going to fix me or make me feel better.
Right.
I mean, That's what I was trying to get out of this guy.
Yeah.
It was useless.
Yeah.
Useless. Therefore, I'm not treating him.
Yeah.
Sorry.
It's upsetting.
All right. So that's it.
Yeah.
You
Want to say thank you to Marco.
Absolutely.
Thank you, Marco. We're going to have
For
some patients
coming.
come in, hopefully.
Thank you for having me.
Come in. And he's always there to help, too, if we need him.
I also
Yeah.
talked to Phil. One quick thing, he was interested in doing like a discount to any military, police, veterans. I don't know if that was something.
Oh, yeah,
wanted to
absolutely. You
mention.
kidding me?
I think
I
we
got a
should
lot
do,
of- I
like,
got a lot of
some
vets,
promotional.
Military,
Uh,
police, vets, especially vets that come in, they got shitty insurance or bad
Right.
insurance or no insurance, and I treat them anyway.
Right.
You know, but absolutely. I mean, if you want to give the kit for nothing for them, we'll do them for nothing. No, I'm just kidding. No, that a discount. Yeah, that would be great. You know,
Yeah.
it's already pretty much discounted
Yes.
living in this area, but
Right.
but we could do it.
All right. So to make an appointment with Dr. Gabriele Jasper, please 732-262-0700. That's 732-262-0700. And for more information about Dr. Jasper and all these wonderful things we talk about, including the PRGF that Marco was talking about, it's all on jaspermd.com. So
And
check it out.
We're located in Brick, 74 Brick Boulevard,
74 Brick Boulevard, building number 3.
right behind Roy Rogers.
Yeah.
Across the street from Stop and Shop.
Stop and Shop. Yeah. All right, guys, take care now. And have a very happy 4th of July week.
That's right.
Yeah. Take all of our